Okay, good day, everyone. Welcome to this to our webinar with our friends at OrgCode on using data and mapping in outreach, resolution, and monitoring efforts with regards to encampments. So our webinar today, our agenda is pretty straightforward. Well, I'll just have a few brief comments to introduce the webinar. Then I'll kick it over to our guests, David and Ian, for a presentation. We'll have a brief question and answer and a closing. Just housekeeping, we've got a pretty busy webinar. We got a lot of people on the line and a lot of stuff to cover. So everyone is muted. If you have any questions for David or Ian at any point during the webinar, please feel free to put your questions in the Q&A, and we'll have a moderated Q&A session once the presentations are done. There's also a chat function. Feel free to share comments and speak with other participants. Let us know you're here and where you're from. Happy to have a conversation. Also, let you know that we are recording this webinar, and it is going to be posted on the website below. Go to our homepage, look for the blog Encampment Webinar Series, and you will find it. It'll be posted within a couple hours of the webinar to closing today. So it's my pleasure to introduce our expert speakers today. Our first speaker will be Ian de Jong. Ian leads OrgCode. You've heard me introduce him 1,000 times. It's probably not gonna. Don't need to go over everything. But Ian is well recognized as an expert in ending homelessness in many specialties, including shelter transformation and responding to encampments, with which he has experience all over North America. Also, happy to introduce Ian. I don't know if David is Ian's stunt double. He has one of the coolest intros, one of the coolest bios I've seen. I go through a lot of boring bios, and OrgCode is cool bios, I gotta say. But David is a problem solver, optimist, and underdog ally. I will let him fill in the blanks, and he maybe, if we have time, can explain Mozilla, why he's a Mozilla maven and a Firefox fan. My kids bug me because I still have Internet Explorer. So what are you gonna do? Anyway, I will leave it there and turn it over. Stop sharing my screen and turn it over to Ian and David. Take it away, gentlemen.
Thank you, everybody, for joining us today. As David pulls up his slides to get us started here today, it's a great pleasure to talk about the components of data as it relates to homeless encampments. And just to kind of frame this as before David launches in, we definitely see homeless data as a tool for service delivery and trying to resolve homelessness through intensive services that see housing as the outcome. And I point that out up front because sometimes when we get into conversations about data and homeless encampments, people think it's about surveillance or it's about Big Brother looking over their shoulder. We look at it from the perspective of, if we don't know the individuals that are experiencing homelessness within encampments and don't have a robust understanding of specific needs as well as barriers that we need to obliterate to assist them in achieving housing, we're going to be very busy but likely be very ineffective. And so as David kind of walks you through his thoughts on data and outreach and homeless encampments today, I want you to keep in mind that this should all result in a very positive outcome for people. The goal is to reduce and end homelessness. David, take it away.
Wonderful. Thanks, Ian, and thanks, Tim. So we're discussing data and homeless encampments, and I would say street outreach specifically, and all things data are probably two of my biggest jams in life. So we are going to have a fun time in the next 45 minutes. Before we get too far into the weeds, I think it bears repeating that as we engage people experiencing both homelessness and housing insecurity, there are multiple concentric circles of a proverbial bullseye when it comes to who are we engaging in this exact moment. And so if we imagine that the persons who we have worked beside and worked along with to be able to collect all their essential documentation, we know them by name, we're ready to house them and are actively doing that directly from an encampment, that's our target, that's the bullseye. But there's also people who are actively engaged in services who aren't there yet. those who we know by name, but they're in the early stages of change and not yet fully committed to the process, those who we don't even know by name, but we know their location and they haven't yet given us consent to share their information, and the broader universe of everyone experiencing homelessness. So we're going to be focused on people across the B, C, D, and E as we're engaging people working within encampments specifically. For those of us who are conducting street outreach activities, we know that the amount of tasks and the amount of objectives that we have as street outreach support staff can sometimes seem insurmountable. Whether or not that's engaging people just to be able to have an idea of where they're located, to having secured their location, understanding their basic safety concerns, to being able to help get them connected specifically to housing and all of the documentation and all of the repeated engagements that help build rapport to get someone so that a system that has often failed them for days and years and sometimes decades will not be too much for them to overcome when it comes to working with us to be able to find that place that they so richly deserve. Recognizing that health concerns play a huge part of that, as does someone's stuff, both before they're in housing and as they're in housing, and all of the related data elements that help us understand the face of homelessness at a person level, at an encampment level, at our organization level, at a provincial level, and at a nationwide level to help us secure additional funds locally as well as across the broader community. And I think, if nothing else, by this point in time, we understand that we want to help work beside and along with others to help them secure coordinated access to the services that we as a system provide, right? If anything else, we know that we've helped people access our coordinated systems. And yet the challenge is, what we're ultimately wanting to be able to do is not just make sure that people access our system in an increasingly coordinated way, but to help them pass through our system, and most importantly, to exit from our system in a coordinated manner. And so that often helps us figure out, all right, we've helped people access our system, what's the next step? And for those of us who've been working with any reporting for a second or a day, we know that, all right, what gets measured gets done. And yet the challenge is, I have yet to find an organization that feels like they're not already tracking not just 1 or 2 or 200 elements, but more possibilities of what we could be examining than they know what to do with. And when I look just at specific funding streams earlier this morning, one of the assessments requires 35 fields, the other one requires 45, the other one requires 60, and the other one requires 80 different fields. So these are just the basic elements that, according to our local, province-wide or national funders, what we need for one specific funding stream. So what happens when we're trying to measure all of those at once, and how do we do that in a trauma-informed way with an emphasis on housing with the side of housing that not only scares our other organizations around the community, but even scares the people we have the privilege to house. So what's the deal with the person on housing? I feel like this comes up quite a lot, right? So these, what we see on your screen here are 10 mathematical and orderly, what we refer to in nerd terms as sine waves. And in this case, we're going to imagine that these 10 different sine waves represent data inputs. They're often seen following political elections or terrorist attacks or medical research, and they appear clear after the fact. But these data pieces appear as ugly messes of spaghetti string before we arrive at a victor or an event or a cure. And after the fact, or following a failure prediction, the pattern of behavior often seems so easy to have seen coming, sometimes so much so as to inspire conspiracy theories regarding secret or advanced knowledge or collusion. And what that looks like for us in homeless services is all of the noise that we have to be able to collect on an ongoing basis. And we might not want to collect this. We might not understand who's exactly needing this information. We certainly might not understand which specific project or funding stream or organization requires which of these specific elements. And so many of these elements often feel like we've been tracking them since the beginning of time, and yet we don't often see these reported out at an organization level or at a more broader in scope level as well. So we're tracking things like the personally identifiable information and the data elements for system usage. So that comes from things like people's basic names and street aliases and when they arrived at our organization and who we are as an organization and where they left and how long that took. It's also some basic demographics, not just of where they were served, but who was served at that location, not just on behalf of the person themselves, but on behalf of the other household members. Because of the person's date of birth, we can then track people's age, both as they entered into the program and as they left. We can track people's racial category or ethnicity, their height, their weight, their favorite sandwich flavor for that matter, their citizenship status, their educational history, and so on and so forth. But that's not enough. We also need to make sure that we track people's income, both as they enter the program and as they leave it. Not just people's income, but the additional sorts of benefits that people are able to obtain during our service that enter the project. The history of people's homelessness, not just at how long it was, but how frequently it occurred, where it occurred, and the different sorts of housing support staff that have accompanied them throughout their experience of homelessness across time. We need all things assessments related. Everything that comes to the engagements we're doing, the housing move-in information, so not just when we were able to make that initial housing offer, but when the unit was identified, when it actually passed inspection, when someone was leased up, when someone moved in, who helped do that, and the times that we have engaged them both prior to and post-housing, and all the documentation that requires. And this is what we refer to as so much noise, where as we begin going with the demographics and the basic identifying information and the system information and the non-cash benefits information and the income and the demographics and element after element after element, it often feels pretty challenging to figure out amidst all of that noise, where is the signal of what we're actually trying to be able to not only learn, but that which helps us and speeds up the process by which we work with people to secure housing. And it's ORCODE's opinion that one additional piece of information isn't going to help you end homelessness, or 2, or 20. For those of us who've been doing this for a moment, we've seen more and more and more and more and more and more, and the side of more information seemingly be the answer that will help us magically unlock housing. And for those of us who've been conducting street outreach activities, particularly for those of us who've engaged in encampments, we know that we already have quite a few pages of forms required on behalf of quite a few providers prior to being able to help someone secure housing. And the question is often, of the 10 pages of information we have, or the 5, is there any element here that we've been asking for a second in a day, but we might not actually need anymore? And rather than asking more questions, is there a way that we can actually ask less, but the things that we ask actually matter? Which leads us here into my Sith glow on my face as we ask, so what do we track? The who and what we measure about people both housed and not yet having secured it. And here would be the recommendations working with North American communities, specifically within a Canadian context, specifically for those of us working with encampments. We find these data elements to be the most useful. First is the count of households in the encampment itself. What other additional funder requirements you have, with a focus on if there's any way in which we can streamline that from 10 pages down to 8 and 8 to 2 and 2 to 1, then please, for no other reason than trauma-informed services, let's try to be able to figure out how we can make that process go from 10 pages to somewhat less. The date that they actually arrived in the encampments, recognizing that people have had a frequent encampment stay when they're also experiencing chronic homelessness, and so how many times that was involved, both within the last year specifically, within the last 2 years specifically, and in the last 3 or more years. And we often say, track that flexibly. So if your data system best tracks that in days or weeks or months or years, that's fine, but that has to be consistent across the community. So we often say to actually track that in measures of nights, because we don't know whether or not 12 months, or whether or not 12 means 12 months, whether or not it means 12 mouths, 12 mobs, and all the kind of elements we get when we're looking at non-integer fields. We could talk for an hour about that. The frequency of the encampment dismantling events. right? Sometimes we hear this referred to as the encampment cleanings or encampment clearings, but these are people who aren't cleared or cleaned, right? These are the actual encampment dismantling events. So for the people who we've engaged for days or weeks or months or longer, how often they've been involved in those encampment dismantlings. Under the assumption that people are in an encampment because it presents the solution for their life circumstance as they see fit in this moment, because the homeless service delivery system or shelters specifically have not met their needs as they perceive them. So what are those reasons? And let's figure out if any of those have been addressed since the last 2 years when they've come in, then that's helpful for us to know. If any of those represent ongoing issues, and to the extent that that is system-wide across encampments and across our broader service delivery system, that helps us not only work with the people residing in encampments to secure housing, but it helps us figure out how to better coordinate access to not just housing, but shelter for those who are able to come inside, as we're actively on a daily and an urgent fashion working to secure housing each and every engagement, each and every moment. Whenever it was that they last occupied shelter, how frequently that occurred, what they perceive as the obstacles for them being able to secure housing, not just shelter here, but housing, which is what this is all about. To what extent and how they're integrated currently or having had engaged both now and in the past our local coordinated access prioritization and local processes here. And since this is about housing, not just the dates that we've engaged them to secure housing, but a brief summary when it comes to what each of those housing-focused interactions as they've resided in encampments have involved. We'll talk about this more momentarily, but the latitude and longitude, we'll call these the geo-coordinates of each housing-focused contact, when they were last housed, how long they stayed there, the distinct episodes that someone had of homelessness across the last 1 year specifically, 2 years specifically, and 3 years, and then the health information, recognizing that people's health concerns are always foremost of our engagements with them. So with those specific elements here, the goal was to not collect data for data information's sake, right? This is what we often refer to data, making it more than just a 4-letter word, especially one that doesn't involve asterisks. So when we try to be able to figure out, not just at a person level, what does this look like, not just on behalf of our outreach teams and working with the engagements, but how do we look at that at a more aggregate level across each of our outreach teams and across our broader service delivery system. So this looks like taking all those data inputs and being able to extract them in a way that makes sense. So this is the slide that's going to make you cry inside. And I'm okay with that for a moment because we're going to visually demonstrate what each of these data points look like in just a second. So part of what we're looking at when we're engaging encampments is the relationship between people residing in encampments and our current shelter system specifically. So it's helpful for us to know, as we see encampments shift or grow or reduce, how many of our shelter beds are actually currently occupied. In order to know that, we need to know not only how many of them are currently filled, but what's the maximum capacity? What does it look like on a full day for our specific shelters, not just individually, but at a system-wide level? How many of our shelter beds are full? Having encampments when every shelter bed is occupied represents a dramatically different picture than having encampments when only 30% of our shelter beds are occupied. In order to be able to ask some of the questions that arise as a result, we need to know what that looks like. We also want to understand how many of our permanent housing resources, whether or not that's the financial resources, whether or not that's actual slots or units, however it is that you actually quantify that, how many of our permanent housing resources are currently occupied. So if we have 99 out of 100 of our housing units or slots occupied, that also represents a different scenario than if only 80% of them have been secured. It's not enough to just be matched to housing resources. We want to make sure that our housing resources are filled to the maximum capacity and that we're using that reality to help us articulate the need to be able to secure additional housing resources for the people we have the privilege to serve. It's helpful for us to know not just the average, but the median length of time from when someone is first engaged in an encampment until someone moves in to housing specifically. And then not only for encampments, but does that change when we look at people who are residing in shelter from first engagements and housing move-in And recognizing it's not just for people in encampments, not just for people in shelter, but it's also for people in other places not meant for habitation. So whatever that looks like, that we can be able to look at trends across those specific populations, recognizing that these are not universally mutually exclusive categories, that people can shift from shelter to other locations, from other locations into encampments and back forward. But what's helpful for us is to not just anecdotally know that that sometimes occurs, but actually being able to quantify to what extent are these categories mutually exclusive. When they're not, what's going on there? Does this look different as the months get colder? Does it look different at the beginning of the month versus the end of the month? Are these patterns specific to individual persons or in individual encampments? So to be able to do that, we've got to be able to track who is in each one of the specific housing location types, or not housing locations, but homelessness location specific scenarios. How many people we've engaged, both at a daily, weekly, monthly, quarterly, annual basis, and how many times we've been required to be part of encampment dismantling events since the last time we examined our data. Here's all of those data elements described in one way here on a community center command center dashboard. So this would be the people moving from encampments to housing according to this reporting period, whether or not that's at a weekly basis, a monthly basis, and at a more aggregate level if we're looking at that quarterly, biannually, or annually. And this is what we refer to as our checking account scenario, right? So how much money do we have at the beginning of the month? How much money comes into our checking account? How much money leaves our checking account? And when it leaves, is it for an explicit understood purpose, or is that sort of my walking around money that I don't know exactly where it's up to? I just know it's not in my account anymore. And where I began, plus the new money I've got coming in, plus the money leaving out, is how much money I have at the end of the month or the week, or however it is that we're looking at our own financial information for those of us privileged enough to have access to something like a checking account. And we're trying to make that basic mathematical formula work within our homeless service delivery system. And so we're looking at how many people are experiencing homelessness at the beginning part of the reporting period, how many new experiences of homelessness happen, specifically in encampments during the reporting period, of people who leave encampments, how many of them leave for housing, and how many of them leave but for other reasons than leaving for housing. We may not know exactly where they went to, we just know that they're not here in the encampment today, resulting in how many people reside in the encampment at the end of the reporting period. What we're doing here when we're tracking this is trying to make sure that we want to not only measure, but we want to publish and show and re-show and re-show and make accessible exactly how many people we house each and every month. This is what ending homelessness means, right? And you want these outcomes to reflect the highest vulnerability of folks, not the least. And to be clear, this is a simple line graph or a bar chart, right? But this is often what's most helpful in us being able to track how many people were housed this week or this month, and then being able to drill down or narrow our focus to be able to look at different population types, right? Whether or not it's people in this category or that category, people in families or people that are single individuals. You can change it by age, you can change it by any kind of demographic, but being able to have that same kind of dashboard be easily filterable so that whenever we're trying to look at a specific portion of people across our overall encampments, we can drill into the data, and that doesn't require an extra day or longer to be able to pull. It's part of the same sort of, wherever possible, automatically generated kind of data dashboarding. Another example here of the community indicators as we're engaging people in encampments is not just the location of where they are, and that can be as specific as possible, all the way down to a geo-coordinate level if you've got it. Otherwise, it's just the nearest location or the address, the date we first detected it, how many unique individuals were on site both last and this week, and the percent change that's involved with that, the specific number of structures on site last week and this week, and the percent change as we look at that, and the number of people housed both last week and this week, and the change week across week, and how long it's been, not just this week and last week, but since this encampment was originally engaged, how many people have engaged specifically from this site, as well as the other kind of information that you want to have be readily available so that when additional follow-up questions arise, things like the count of assessment coverage, the count of basic presiding health conditions, the stated desire for when the encampment is specifically closed, all those extra elements here, not necessarily aggregated, but having readily accessible when it comes to the additional kind of community notes.
And you can have one of these per encampment within a community, and this encampment dashboard, as you'll see in a moment, can also be rolled up to all encampments across everywhere. So if you had 5 encampments in your community, you could have 5 of these summaries that would allow you to take a look at each encampment discreetly and better understand exactly what is going on in each of them. And it'll also help you understand at a deeper level when people say things like, it's growing bigger. Well, we can actually track things like whether or not that's true, and if so, when and how is it getting bigger, so we know how to deploy more resources to provide enhanced services when we track information like this.
Particularly when we see that encampments, even as and when they are actually arriving at a closure date, for those of us who've been working in this industry for a moment, we often recognize that those encampments pop right back up in the exact same location in a later reporting period. So having quick access to that and making sure that our local community funders understand what that looks like, the efficacy of encampment closures, and the recognition that there are often instances where the encampment we're looking at today was in fact the encampment that we closed 3 months or 3 years ago. We want to also be able to use the information we already have as part of our system here, right? So we want to start quantifying the pre and post housing costs of the people that you're housing. So the VI SPDAT and the SPDAT include this information specifically so that you can use it, or you can try to determine the cost for an average EMS or an average policing or an average emergency room visit, even if it's just a rougher than you'd like estimate, and show the cost savings. It's not just the financial cost savings either. So it's also the sheer amount of time that's saved and the quality of life improvements that come with taking 66% less EMS trips or spending 40% less days in hospital. So that was a lot of what we recommend when it comes to both the who and what we're tracking of the people we have the privilege to serve. But we also want to be able to track how we track the information of where people are getting housed and where people are not yet housed. All things contact tracing, right? So here's 2 sites we've used frequently, both latlong.net and where-am-i.net, for being able to press on your phone, share location, and you automatically get geo coordinates readily available. For those of us working with tablets or computers, you can go to the site as well, and you can confirm the ability to do that. You can plug specific addresses in or specific landmarks, and it will also give you that. And where you have specific geo coordinates, it can often work reverse to be able to give you, put in the geo coordinates and then it pops up which specific spot that was at an address level wherever possible. So we found that both of those sites to be tremendously helpful. We include that in the person's actual electronic record. That's timestamped so that we can know as people move across time, both in the specific encampments, within encampments that are in different locations, from encampments to shelter, and from encampments to other places not meant for human habitation. That's remarkably helpful at being able to engage people as we can see their usage patterns change across time. And we're recognizing that as we have COVID outbreaks, how important it is for us to be able to use positive cases to determine what else might need to shift in our processes, or the ability to flag people needing to self-quarantine in place because of local outbreaks, specifically at this encampment or at other nearby encampments as well. And there are a litany of different mobile technology options for helping us track this. So what we see on the screen first is SIMTECH'S Show the Way app, and you can have the client information and the follow-up that we're doing with them. You can be able to track that at an encampment level across your system, specific observations that your staff and housing support specialists are noticing, and the connection to resources to the extent that that is updated within the app itself, zooming in and zooming out on the map, and having the ability to look at basic concepts like the elements that we looked at prior to these data dashboardings, not just the aggregate level, but at a person-by-person level. What are those specific elements? And we've got the websites on each of these slides here. We've been using ZMaps oftentimes So this helps us be able to take existing Excel spreadsheets or whatever data system spreadsheets that you've got, upload them at a de-identified level, and to be able to track that at a map using just the Excel spreadsheets themselves, as long as the information is de-identified. This can be remarkably helpful at being able to look at, again, zooming in and zooming out on all the basic questions that we're asking of the previous recommended data elements. UMAP here. This is another one that's pretty similar to ZMaps. It's open source. You're able to do different elements on the map on this one than you can in the first one, but I'm not a representative for any one of these specific organizations. We just recognize that different communities across Canada have seen different levels of success with these most frequent elements. MapLine, this is particularly helpful when you're having staff that are using existing websites or existing infrastructure for tracking people's movements across encampments, specifically through things like HIPAS, and the ability to have multi-user platforms that multiple people can all be on the same data platform, but having it be online as opposed to specific to an app. And recognizing that as we're engaging encampments, especially larger encampments, we might need to be able to narrow in on some of our focus. So if we're able to actually plot out on any sort of grid where we are, and that helps us figure out across a large encampment, who's getting engaged, what areas are being engaged, and being able to drill in on different demographics and on different things like who's been assessed, where do we see the most movement in and out of that. That can be remarkably helpful when you're looking at 100 or multi-100 person encampments, at being able to say it's not enough to just have the encampment's location and its geo coordinates. You're also wanting to have that tracked out on a proverbial grid.
Now, just for a moment there before you go further, David, because it often comes up with the mapping, is we would never want to map any individual without their consent. And we would want to make sure that as part of our initial engagement process, people would understand the reason why we would want to actually map their location and their relocation, in the relocating and assisting with housing. We also want to make sure that people have the absolute ability to say, no, I don't want to participate in your mapping, and then they're not included in the mapping. So for those of you who have concerns about like what's the impetus behind this, yes, there's a resource allocation piece. How many outreach workers or how many staff do we send to specific encampments based upon the volume of people and where they move? And the relocation function is to streamline that process, but also it only occurs with the will, consent, and explicit knowledge of the individual that is impacted by that operation.
Indeed. As we're tracking all of that information at a person level and ultimately at a community level to help us inform our command center dashboards, it bears repeating that we ultimately want to track all of our work around housing, also with the side of housing, and did I fail to mention housing, around three metrics that matter. The first is how many people are moving into housing. We often describe that as being measured by increased exits to permanent housing, which is another way of saying, are we actually effective at doing what we're trying to do, end homelessness? How long does that take? And the length behind someone experiencing homelessness, ultimately we want to see that time be reduced wherever possible, which is another way of asking, are we efficient? And lastly, how many people return to homelessness? Recognizing that we want to help people secure housing and have that housing be long lasting, which is another way of saying to what extent are we enduring. We're also wanting to look at system-wide performance measures. And as we do that, we are going to put that into three different categories here. How do people access our system in a coordinated fashion, which is going to be measured by the indicator of how many people are diverted from homelessness wherever possible and how many people, in fact, aren't able to be diverted, at least this time, and thus experience homelessness, specifically in an encampment. As people access our system, check what's next, to what extent or do people pass through our system? So this is the length of time that people remain homeless and the employment and income growth that can often help facilitate that process. Ultimately recognizing that it's coordinated access, but not just to homelessness, but coordinated access to housing. Another way to say is, as people engage us and people pass through our system, we're trying to get them to exit homelessness, exit the encampment to housing specifically. And that looks like the extent and count and percentages of people who are able to successfully move into permanent housing, and the extent to which people who exit homelessness, specifically to permanent destinations, actually return to homelessness. We found that those elements can often feel slightly overwhelming. And so we found the following metaphor to be helpful at being able to track what this looks like at a system performance level. And we're going to overlay these two in just a second. So if you consider a bathtub, and in a metaphorical bathtub where the water represents people experiencing homelessness, often specifically within your encampments, our shared commitment to ending homelessness should look like draining the tub. So it doesn't matter if it's 100 people, or if it's 10 people, or if it's 1,000 people across encampments representing the water and the tub, we want it to be less. That's our goal. We recognize that new people are entering our encampments, new water is entering the tub at any given moment, and that people are leaving encampments as well. So to a certain extent, the drain is on and people are leaving it. The thing that I would give you as two caveats are, first, some of the new water has always been there. It's just that it's newly being measured. And the second caveat would be, we don't always know exactly where the water goes, right? So if we describe that as, all right, we've got a proverbial bathtub of people experiencing homelessness represented by their stay in an encampment, we've got three primary strategies for having the amount of water in the tub, the amount of people experiencing homelessness in encampments, be less. One, we can reduce the inflow into the encampments, into the tub. So that looks like all things coordinated access, coordinated assessment, and coordinated entry. It's emphasizing homelessness prevention, it's emphasizing diversion, and the following system performance measures that we were describing there a moment ago are within this specific elements and within this specific strategy of how and to what extent are we able to reduce inflow of new homelessness within encampments in our system. We can also make sure that we decrease the time required as a strategy, which is all about coordinated passage through. And to the extent that we can have 15 forms be required as opposed to 500 or 3 versus 6, the extent that each one of those forms requires 100 elements versus 10, wherever we can reduce the amount of what we would say bureaucratic mumbo jumbo, we can speed up the overall amount of which we can work with people to be able to help them secure housing. And if they used to take us 30 days and we can make that move down to 15, that's the same equivalent as being able to have halved our inflow into new homelessness. And we're also wanting to be able to help increase the outflow. So for those of us who've been working in encampments for a while now, we might recognize that it might be difficult for us to double our housing rates from encampments. And so often, those who aren't in the weeds doing this work on a daily basis can lose sight of the fact that it's not just as simple enough as doubling our housing rate, because we're already working well over the 40 hours, well over the 5 days a week that others might associate being involved with our job. And so the concern isn't which one of these three do we do? To what extent do we reduce inflow? To what extent do we decrease the amount of time? And to what extent do we increase the outflow? It's usually a combination of those three. But at a system-wide level, it's important for us to figure out, where are people getting stuck? Is this fundamentally a question of access and entry and assessment? Is this fundamentally a challenge of, we've got people entering our system, accessing it, voila, but we can't pass them through our system? That's where people are getting stuck. And to what extent are people actually exiting our system? And recognizing that the answer to that might change by encampment and might change across time. As we work with people on a regular basis here, it also bears repeating the questions that we should be asking and re-asking and re-asking here. So at a community level, when you're doing this work, to take a step back and to say, in what concrete ways can we increase the amount, by which we mean the sheer quantity of people that secure housing from encampments, and what do we do towards that objective? To what extent can we reduce the bureaucracy, connect supply to demand, and move with an urgency that almost scares others, but in a good way, to speed up that process? In what ways can we provide housing first, not housing only, to support people once they move in? And can that involve housing options with choice, not placements? And even in encampments, can we, and to what extent can we, still divert people from homelessness? We want to measure our impact at a system-wide level, quantifying the support how and to what extent and where we're seeing challenges at connecting people experiencing new episodes of homelessness to either safe supports or to rapidly help them connect to housing resources wherever possible. We're wanting to make sure that we prevent and divert people from homelessness wherever we can, to quantify the cost savings involved in that process, and the prioritization of people, recognizing that there are people in different kinds of scenarios across encampments and across time, recognizing that homelessness is homogenous in the sense that it involves a lack of housing, but there are all sorts of nuances across encampments and across people and across time, and being able to regularly quantify what that looks like, with an emphasis, just like we've been doing in coordinated access more recently, to help us prioritize people who not just have the highest medical vulnerabilities, but those least likely to be able to escape homelessness other than through our ongoing supports.
David, stellar job. Tim, we are ready to take questions.
All right, everybody, we've got a number of questions ready for you. Now, if, again, anybody has any questions, please put them in the Q&A tab. Couple quick questions about software from Michelle. I think you've probably answered these, but just really quickly, what software tools do you use for your dashboard, and what do you use to track cost savings and SROI?
So we'll see all sorts of different options here. So we see some communities who use Tableau. We see some communities who use BI. We see some communities that are using ClickSense. So there's different sorts of online dashboarding software that help us track the aggregate level. But I'd also say there's a whole lot of things you can do just using Microsoft Excel and using Microsoft Access. Some communities also have that actually built into their customized HIPAS reports. And for the communities that are using HMIS, sometimes they build it in their custom HMIS as well. But more times than not, the dashboards I was presenting there were just in Excel, which is easy to replicate if you need to use that with an online visualization platform like Tableau or Power BI. When it comes to the cost savings, that is the average cost as determined by each of those respective systems when it comes to what is the cost of an inpatient treatment at detox. What does it cost for an average ambulance ride? What does it cost for an average policing encounter? And as specifically quantified as possible. So if your policing staff are able to identify the average cost for someone actually believed to be experiencing homelessness, and that's more helpful than the overall average cost of a police encounter if it's including all sorts of other events other than just engaging someone experiencing literal homelessness. So as specifically as possible, but that's often connecting with those systems of care and saying, I don't need this information at this granular level like you're giving me. I just need the average cost to the extent that you can quantify that specifically for people experiencing homelessness. What does that look like for ambulancing, detox visits, EMS trips, so on and so forth.
Right on. Here's a question that I think is going to be important for a lot of communities. So Betty from Winnipeg is asking, is this information operating under OCAP principles? There have been decades of information collected on Indigenous people, but not necessarily shared with Indigenous organizations or leadership. The result is our lives don't get better. In Winnipeg, there is between 70 and 75% of the people experiencing homelessness are Indigenous.
I think that at the local level, they should decide where and how the data is stored and how the data is analyzed and how the data is used. I think if you are specifically talking about this notion of if data is collected by Indigenous organizations, then there's data sovereignty for those organizations if they're also involved in working through the response. I think that then you figure out what are the connections to the other systems of care and the data points that would need to be shared at an aggregate level, but at an individual level, it could certainly stay with the specific providers. And also, we're really trying to narrow the focus so that we're not treating this as a research project in that people's lives are open book for us to capture as much information as possible to then do a whole bunch of other things with it down the road. And I think that has sadly happened with a number of population groups. We want to keep this heavily focused on encampment resolution and make it operationalized. And if that is Indigenous owned, Indigenous run databases, and if that makes sense in local context, then that would make sense in the local context.
Betty's also asking, is there any desire to collect information on where people are originally from, i.e. home communities? Many people come to the urban setting because of various reasons, education, access to housing, medical, etc., and end up getting lost in the city.
I think what I would say in that regard, and David might have additional comments, is sometimes funders require that information. Sometimes it's collected as part of point in time count information, in which case, if you have that information from other sources and you can already make the case that people come to a specific location for a variety of reasons, then you don't need to collect the information again. It's one of those, would that information be necessary to understand all encampments in a specific encampment? Now, where it might make the most sense, outside of those other ways that we've collected some of the data historically, is at that individual case planning or service engagement level, in which case, if I knew that David came from a specific community and he had a desire to relocate there, or another community, or that has family or friends within it, or go back to a home community, then that would be part of our service plan. It's part of our case notes, but not necessarily part of the aggregate data. That said, if there was a strong pushback in a community that, and you'll hear this sometimes, the people in encampments are all from somewhere else, right? And sometimes there's variations that all people who are homeless are from somewhere else, everybody who's filling up shelters is from someone else, et cetera. And that is flavoring the local response in terms of there's pushback because a particular urban community, it happens more in urban centers, feel that all the suburban and rural communities have dumped people into their communities or have just become magnets for the people in communities. Then it might make sense to collect some of that aggregate data to create a bit of a profile of where people come from. But even still, I wouldn't want to enter into any conversation that somehow delegitimizes people's Canadian rights to mobility.
Would it be fair to say, Ian, that that there's a couple of guiding principles when you're thinking about data collection? One is that it has to be governed by consent, like there has to be very clear consent from the people involved, and it's their data that you're collecting, and they own it. The other thing is that we want to have as light of a touch as possible. Like you only want to collect the information that you need, not that you're interested in. Would that be fair to say?
I think it'd be fair to say both those things. I'd add one more point on the first part about consent, making sure people are absolutely clear of how they can revoke their consent at any given point in time. So I think we do a good job on the front end of making sure, or a better job than maybe we've done historically. Here's what we want consent for. Here's who we want to share the information with. Being explicit if we are going to use it for research or other purposes, being clear about that. And then not forgetting, if you change your mind, if your circumstances change, or you no longer want your information shared, here's your recourse of how you follow through on that. So just a few points that I'd make a little bit finer tip on the first comment.
Mm-hmm. Okay. Question from Carmen with regards to the apps that you're using. Are there no privacy concerns with using some of these apps? I know that when she's saying that, I know when they've been created in various encampments, their privacy department always needed to be involved.
So when I was doing frontline service, I would get at least a call a week from an app developer who was promising me the perfect solution to our homeless service delivery system based off of their specific mobile product. So I would say, yes, these privacy concerns not only exist, but they are unrelenting. And there are different kinds of apps that can do that better than others. And you could spend an entirety of a full-time staff equivalent just engaging with how do we use mobile technology better, or how do we develop our own. So the important thing to consider there is that you're not making this decision at an organization specific level wherever you can. So the intention is, as people are moving from encampment to encampment, or from experience of homelessness to experience of homelessness, whatever that involves, that if they move from one encampment to another and suddenly they're no longer on the app because you as an organization decided we're going to use app ABC, but the rest of the system did not, then there's really limited use for that. And the people who are more exposed are, in fact, not part of that broader system of care. So the intention behind this is that it's not just solved at an organization level, but as that organization feels like we've got a handle on this, we know of a way to be able to describe this specifically grounded in, we're working to house you, also with the side of housing, and we want to make sure that we don't lose a day or an hour with struggling to find you. If, as you're engaging services, they're already tracking where you're at, we can be able to deploy staff to in real time contact you to get you into housing as quickly as we can, and that metric and that script is not just stated, but believed and standardized across the system. So this is definitely something you want to have resolved at a community level to make sure that not only are you, on behalf of the persons you're supposed to serve, but also when it comes to your own legal liability with sharing some of that information, or at least collecting that information on behalf of the people you engage.
And the examples that we showed today are just that. They're examples. They're not an endorsement by us. We just know that they are used in some communities in different ways, and so wanted to showcase that for some of you today to do some of your own follow through and due diligence. But I also don't want people to get the impression that we are firm in our understanding of all the privacy considerations that they put into the apps. It would require some more research on the part of any of you who are interested in that technology application.
Jacob has got a question or a comment and a question saying, thank you so much, David, for an amazing presentation. I was wondering if there are any additional statistical methods that you use beside counts and averages, medians, to analyze your data, for example, regression, parametric or versus non-parametric approaches, etc.
Yes, but that isn't something we see happen frequently at a system-wide level. So whether or not in a lot of our work, we see Microsoft Access being able to help us connect longitudinal data sets and to be able to do regression analyses across different kind of demographic groups. We'll sometimes play around with SPSS to be able to look at that as well. But the answer is more no than yes in response to your question there. So I'd say at a system-wide level, we're most interested in people entering our system, people exiting our system, and how long that takes, and being able to compare that across time, across agencies, across encampments. So there's an element of longitudinal regression when it comes to that, but the statistical method you're specifically describing, I would say infrequently we see that in our work.
Anna's got a very good question here. She's asking, given how the invisibility of encampments can be protected, and your goal as mapping and data collection is to get a complete picture, how do you negotiate the representation of 10 cities? Are there participatory methods for data collection and mapping beyond consent?
I think this is a really great question based upon the nature of the encampment and the nature of the community. So for example, you can have a participatory process that didn't require a bunch of outreach workers going to collect information if you had leadership within the specific encampment that wanted to use a more participatory method with other encampment residents and kind of present it back as a whole. It'd be less obtrusive, and you could actually build a fair amount of trust and relationship in that way. So that is absolutely possible to do that. I think the other consideration that we have here is looking at those opportunities for knowing when and how some encampments organize differently than others, and some are resourced differently than others as well. So I would never say that we could do it universally, because not every encampment is going to be at a place of organization or interest in doing that. But for those who are, I don't see any reason why we couldn't have a participatory process with encampment residents to gather information that could be entirely acceptable. And I think the only thing that I would further say is that for some encampments that, you know, and especially not always urban environments, but sometimes in urban environments you hear about these encampments that are tucked away, that are kind of out of the way, that no outreach worker has been invited to, and yet there's supposed to be people living there. We might also engage in dialogue about it. Well, if you don't want us to go there, how can we still serve you and try to come up with housing outcomes for anybody who's interested? And that might be another opportunity for participatory engagement.
Thank you for the question and the answer. Malcolm is asking, how have you addressed information sharing across agencies, specifically BC Housing and health agencies? Do you use a universal consent form of some kind?
So I can't speak specifically to health agencies and BC Housing in BC. I can only speak generally of what we've done in other locations throughout Canada, which is getting people to co-create consent forms. And if you start from a place that they're co-created and everybody's I's are dotted and T's are crossed, that seems to be the best way to go. If you start with one side wants their consent form to be approved by the other side, and the other side wants their consent form to be approved by the other side, that gets a little bit trickier, especially when they end up being like ships passing in the night in terms of information goes unevenly one way compared to the other way. Whereas if you co-create and you have everybody's interests and you have everybody acknowledged, and that's transparent to the individual from whom you're trying to gather consent from, I think that's actually the best way to go.
Mm-hmm. Are there places, Ian, that you and David, Ian and David, that you've seen where there are some really good workarounds if that hasn't been in place? I am thinking of Fort McMurray, for example, that had a really interesting approach of having that you couldn't get Alberta Health Services to share information or share information with them, but it was shared through the person that was able to collect both, like to get people to get the systems connected through the outreach worker in the hospital.
Well, I'd also say that, and as part of this process, it's always a matter of like, what detail of information are we sharing and for what purpose, right? So if I'm on the housing side of the equation, I only need to know the information that's pertinent relative to my work to try to help someone get housed. I don't need to know their entire, for example, psychiatric history, or I don't need to know their entire chronic disease management history. I need to know, is this a person that I need to continue to have them stay connected to healthcare as I work through, and I might not even know their diagnosis or what's going on. That's the sort of information flow that I might need back. So I also think when we have conversations about consent, what's the amount of information that I need to know to be effective in the space of delivering a housing focused service, not what's the piece of information that I need so that I seemingly now know everything about this person. If they wanted me to know all that information, they would tell me themselves, and that's their right, or they would keep it to themselves, which is also their right.
Robin is asking, this is all very informative and useful and affirming, which is always nice. Thank you. We are developing a GIS mapping with hyphas feeding in various information points. My question is how to best work with and incorporate the police outreach encampment programs when the homeless system does not want to set up any general consents or access to hyphas. So the police give us information, but we don't share any of our quote unquote clients' information. And they leave the room, being the police leave the room for anyone they don't have consent for. I understand why it's like this, but I'm wondering if you or anyone have better ways of doing things. How to set up a very limited and specific consent for police programs working with people staying in encampment.
Yeah, so I'd
go
say
ahead, David.
Sorry. Yep, this scenario is more frequently occurring than it is not. So what Robin's describing there is you have the ability to work with specific households to be able to quantify their specific housing costs, both pre-housing and post-housing when it comes to their emergency services. How frequently I was interacting with police and hospital, ambulance, all that, prior to housing and post-housing. And you can actually get your own $1 Million Murray case file that's feet thick on behalf of a person-by-person sort of level. That's remarkably challenging to do at a system level and requires an incredible amount of time that might be better spent actually housing people. And so what we see happen more frequently is if you're able to quantify, just tell me the number of those interactions on behalf of the person, right? Then what we're going to do is we're going to get the aggregate, not identified person by person level, but the average ambulance trip costs $800. And so if we have 1,000 stated ambulance rides on behalf of people in encampments, we just do the math for that. You're not, granted, one person's ambulance trip is going to be $750 and the other person's is going to be $900. But it's less important for us to get the person by person by person exact specific cost of every detox visit and every hospital stay. It's more important for us to have the average, and thus the information that people are already providing as part of our coordinated access and prioritization process is able to help get us to that system-wide analysis rather than getting stuck at a person by person level. So yes, that is very much the case, and I would say doing it any other way might take more time than you have.
And I'll just add in, when it comes to information exchange with the police about specific encampments and specific people, this is very dangerous territory in a lot of jurisdictions because there's usually different motivations, right? The motivation on the part of the street outreach worker is to house. The motivation for the police may be something completely different. If the police are running the street outreach services, which happens in some jurisdictions, that there is no street outreach, so police are doing street outreach, then I would say that, and I'm not an expert in this field, but I would say that you probably want to go back to looking at what is the consent for information that's actually being shared and who needs to know what. That would be the lens for which I'd apply it, regardless of the party, in terms of gathering that information. If the police are not the street outreach provider, in other words, they're removed from that, then I for sure would want to know if police have detected an encampment, let us know so that we can get a social service response going to that encampment or confirm that we already knew that it existed. That's helpful information. If it's police wanting to know the details of every single person's service plan in that encampment, then no, that's not the sort of information exchange that we're looking for. And where I'd say you probably find middle ground is being able to articulate that you are working on the encampment and be able to demonstrate your efforts in working on that encampment rather than getting it granular down to the individual person.
And I think, you know, getting back to first principles too, like we want to ensure that there is a housing response for people in encampments, and our focus, you know, the police often are looking for a resolution for the encampments. We're looking to end homelessness for people who are in the encampments. We got to navigate that relationship pretty carefully, and with, I think, with the consent of the people that are in those encampments. Would that be fair to say?
Yes.
Yes.
I think we've got, I think that's, wow, I think we've basically hit all of our questions. Let me just double check. Yeah, I think we've basically got to all of our questions and just in the nick of time. So with that, I will we'll wrap this webinar. Thank you to everyone who's attended. The recording of the webinar should be up on our website on the blog on encampments at caeh.ca within the next couple of hours. Just to let you know that we're working with ORGCode as well. We've mentioned this in previous webinars, but we're working with ORGCode on the development of an encampment toolkit that we will be making available soon, for certainly as a first step, open for a discussion and conversation. So with that, I want to thank David and Ian for a terrific presentation. I want to thank everybody for attending. If you have any questions or comments, this is how you reach ORGCode. You're certainly welcome to reach out to us as well. And with that, I offer my thanks to all of you doing this very, very important work under very, very challenging circumstances. Thank you for everything you're doing. Thank you for joining us. Feel free to stay in touch, and please do take care of yourselves.
Thank you.
Thank you, Dave. We'll talk soon.
Bye.